Carpal tunnel surgery is one of the most common hand operations we do at St Joseph's Hospital. I'm Andrew Rogers. I'm a consultant orthopaedic surgeon and I specialise in hand and elbow surgery. Carpal tunnel syndrome is compression of one of the main nerves that leads to your hand, the median nerve. That compression occurs at the wrist, and that compression leads to symptoms typically in the hand and maybe in the forearm. If an individual has nighttime pain, waking with numbness in the fingers in the morning, particularly if the numbness is in the index, middle, thumb and ring finger, that gives a high suspicion that they have carpal tunnel syndrome. The treatment of carpal tunnel syndrome can begin with simple measures. Some individuals can respond very well just to the application of a splint at night. The next step would be to try a steroid injection. The steroid injection usually gives very good relief for several months, if not 6 months to a year. Once you've had your symptoms for over 12 months, and in particular if you have signs of severe compression of the nerve, you've got constant numbness in the hand, you've got muscle wasting, that would imply that the nerve is being severely compressed and it would be beneficial to proceed along a surgical option. The operation for carpal tunnel syndrome is a minor operation which is done under local anaesthetic. We cut the skin, we cut the fat underneath the skin, and then we're down onto what we call the carpal ligament, which is the thick roof of the carpal tunnel. We then cut the carpal ligament, and that allows the tunnel to expand. It drops the pressure in the tunnel on the nerve, and then that leads to resolution of the symptoms. In terms of the recovery from carpal tunnel surgery, symptoms such as the nighttime pain that's keeping them awake usually resolve very quickly. Often the night after the surgery, individuals say that pain's gone away. In terms of the other symptoms of carpal tunnel syndrome, in terms of the numbness in the hand, if the numbness was not permanent, then usually that resolves fairly quickly over the first few weeks. If you had permanent numbness at the time of the surgery, then that may take longer to resolve, anything up to 12 to 18 months to see the final improvement. I think the important aspect is once you start noticing your symptoms are lasting longer, not getting better between attacks, and particularly if you notice weakness in your hand, then getting treated early has a greater chance of resolving your issues completely, whereas if you delay treatment, then the surgery may not be fully successful. I think one of the most satisfying aspects of carpal tunnel surgery is the immediate pain relief that patients experience. Most of them, by the time they come back to their follow-up clinic, are very happy that the horrendous nighttime pain they were experiencing has fully resolved. It's one of the most satisfying operations that I undertake as a surgeon, and I find that the patients themselves are very satisfied with the results.